Good evening, everybody, and welcome to this Friday, the 16th of July. We are happy to be back and talking as usual. We think we like talking, so we are happy to be talking this evening. Last week we didn't talk a lot. Well, we talked a lot, but we didn't talk all that we needed to talk. So we shall continue with that story of what we were doing last week. So we talk from a platform called She Chooses to Live Initiative. That's an NGO that wants to, I don't know if NGOs want, but it's an NGO that whose workers want to educate people on matters health, especially matters reproductive health, but matters health in general. In fact, in time you hear pediatricians talking on this forum of She Chooses to Live, and many other people, but our base was reproductive health, so we are more starting off with reproductive health than all the other branches of health. But in time we will broaden out and talk many things, including teenagers and such things. In fact, teenage health, teenage behavior in general, and such things. So we come from She Chooses to Live Initiative, and it's an NGO that hopes that in time every woman, every girl will be so empowered about her own body and about the changes that happen in her system that she will not be taken unawares by issues, that she will be aware of like sexually transmitted infections, how they are transmitted, how to protect oneself from them, because some of these things can have lifetime devastating effects on somebody's life. They can change your life from you ever being a Princess Diana to you becoming, in fact, I will not say Wajiko because Wajiko is a good person, but becoming almost unable to survive. So it's a good thing that one knows themselves, one knows their system. In fact, the Bible says that my people perish for lack of knowledge, and it's our hope that we do impart a bit of knowledge to people, the bit of knowledge that we have. We hope it helps somebody somewhere. We are very passionate about especially cancer of the cervix, because it is a preventable cancer. You can almost completely prevent it really by vaccination, by screening, and by catching it early. So She Chooses to Live is very passionate about that, but passionate about reproductive health in general. So that's why we hold these meetings on Friday evenings, and we keep hoping that you would send us requests about what you want us to talk about. We usually take what people ask and we digest it for us, and we talk about it. And we hope that we'll get many other topics to keep this forum moving, because I can imagine what you people don't know, but that is just my imagination. And much of what I do is because of what I get to hear from the clinic. Today I'm introducing myself. First, I'm called Dr. Jane Wakahe because I'm the one who goes to the clinic. So what I hear from the clinic is partly what I talk about, what many women complain about, what many women ask. That's mainly what I've been talking about much of the time. But other times people do ask questions and ask for topics to be covered, in which case we do it quite easily. So I'm Dr. Jane Wakahe, an obstetrician gynecologist. I've practiced for many years in that field, and also I've got a degree in public health, which is what the forum that we are using on this, that She Chooses to Live, because we want to go public to the Wajikos wherever they are found. To my left here is Tech Guy. She's Marion Wakahe. She's, like I said, she's the one who puts me on and who puts me off. those of you who are watching last week, you saw when the screen went blank, how I said tech guy, because I didn't know what to do. So yes, she puts me on and puts me off. That was to do with Facebook. It wasn't tech guy's fault. So last week we were talking about menstrual abnormalities, and we had gone literally all the way almost to the end. We had talked about what is menstruation, what is normal, what is abnormal. We had talked a lot, and I think that video was posted. So if you want to recoup, you can go to that video and recoup. I think the last thing I talked about that time was the causes of the frequent bleeding, the causes of that, the things that may cause frequent bleeding. We also talked about the causes of infrequent bleeding, delayed periods. The delayed periods is quite a thing that people had asked about. So maybe permit me to recoup the delayed periods, because that one people really had asked about it, but you will find it again, it is really posted on that video. So we said that delayed periods, many people will have regular periods, but when the periods delay, especially up to 3 months, that is pretty abnormal. That is not to be taken lightly. So a delay of a period of more than 3 months. But the normal period is usually 21 days to 35 days from start to start. And if it goes beyond that, then it is delayed. If it comes more frequently than 21 days, then it is too frequent. So just recouping very quickly. So some of the causes we saw for delayed periods were pretty obvious: pregnancy, breastfeeding. We talked about age, the extremes of age. When a person is very young, the periods can go irregular because the ovaries are not yet geared to ovulate properly. And then we talked about towards menopause, then the periods can also get irregular then. We talked about stress, a lot of stress, chronic stress on somebody, and we agreed that stress is not equal to each person. Stress is not equal to the other person's stress. So what causes stress, what causes periods to be missed in one person may be very simple to another person. So stress is one of the things that can cause a lot of delay of periods. We talked about weight. Obesity never seems to be left out of things that are bad. So obesity is one of the reasons why a period can delay. But in this case also, very, very sudden loss of weight, very, very acute loss of weight. We said that very, very intense activities can cause delayed periods, like in very athletic people. Those who compete in athletics, sometimes they will miss their periods for several months, and that is just because of activity. We said that some chronic diseases like diabetes could do the same. We talked about polycystic ovarian syndrome. I think I've discussed polycystic ovarian syndrome on this forum. I'm not sure. If I haven't, we shall discuss it. We talked about traveling long distance and changes in climate. We talked about premature ovarian insufficiency, or what is called premature menopause. And this means that a woman goes into menopause, their ovaries finish their reserve before age 40. So if somebody is going into menopause before about age 39, age 40, then they are premature menopause, and that would be that the ovary has gone insufficient. We said that sometimes it is very rarely it is cancer of the ovary, and then for people who have had to have chemotherapy treatment for cancer, then that can delay their periods. The frequent reasons were mainly hormonal, some polyps, endometrial polyps, endometriosis, which means that the endometrium tissues have moved to other places. We talked about pelvic infection causing frequent frequent bleeding, which is abnormal. We talked about our passionate thing, the cancer of the cervix. And in fact, this is a very telling thing. If somebody starts to bleed when they are having sexual intercourse, then they need to really check that it's not cancer of the cervix, and they need to be screened and be told that it's not cancer of the cervix. We talked about cancer of the uterus. We talked about some blood thinning medicines which people take. We talked about other cancers. We talked about cancer of the ovary, and many things. We talked about ectopic pregnancy. So those were the things that are associated with abnormal bleeding, either delayed or over-delayed. And then the other abnormality is when it is very, very painful and very crampy. And the main cause of this is either somebody is very young, so they have what we call spasmodic. Their organs are so tense that their bleeding is absolutely very painful, or they can be having endometriosis, or they can be having pelvic inflammatory disease, pelvic infection. So those are the things the few things that would cause abnormality in bleeding. So we were to then do some investigations. In fact, I think where we blacked out was here, that we were to then do some investigations for this courses. And by this time, if you are experiencing abnormality in bleeding, whether it's being delayed, whether it's coming too many times, whether it's coming spotting in between, and whether it's coming after sex, whatever is abnormal, which is not being your normal, then you by this time I'm sure you have gone to see your doctor. So your doctor is the one who will discuss with you what it is that ultimately needs to be done. But some of the investigations that will be done routinely, whatever is happening, is like some blood will be drawn, and this will usually be to check how much blood one has, especially for the people who are bleeding too much. Then they can have anemia, very severe anemia. So we'll be checking the full blood count. We'll also be checking something in the full blood count. We will be checking something called platelets to see whether there's a bleeding tendency or something like that. In the blood, we shall also check for some hormones that would be associated with irregularity or abnormality of menses. And some of these hormones are cortisol, some are thyroxine, many hormones. If we are suspecting that there may be premature ovarian failure, then there is a check also for that, for checking the reserve of the ovary. There is a hormone that can be checked. So you will be taken blood, some blood will be taken, and a lot of investigations, quite a number, will be done if you are missing your periods, or if you are over bleeding. Then there will also be a pregnancy test check to just make sure you're not pregnant if it's a question of delay. Now, there will be also usually what is called a high vaginal swab, and this checks for things like any infections in the genital system, because the infections of the uterus and the cervix and the vagina will usually show up in the vagina, because that's the outlet. So when a high vaginal swab is taken, then we are able to see whether there is an infection or not. The other almost routine investigation that will be done will be an ultrasound. And this will be an ultrasound of the pelvis, the pelvic organs. Ultrasound is a sort of, I'm sure many of you have had ultrasound. It's a picture that shows the internal organs. It is a safe thing. It's not like X-ray. It doesn't use X-rays. It uses sound, And that's why you see that even when you are pregnant, we are able to take ultrasounds even at a very, very early age of pregnancy, because even when the organs are forming, because this kind of screening uses sound, it doesn't irradiate the system. So much of the time an ultrasound will be done, and this will be checking on the state of the uterus, the state of the ovary, the state of the inside of the uterus. Are there any so-called polyps? Are there any polyps around the cervix and such? Before even the ultrasound is done, then as somebody is doing the high vaginal swab, we usually will have put what is called a speculum, and we will inspect right from outside, because funny bleeding, especially when it's a lot more frequent bleeding than usual, it could be anywhere from the vulva through the vagina to the cervix, inside the uterus, and it also could be being triggered by the ovaries but coming through the uterus. So when we are doing the high vaginal swab, we are also inspecting that there are no cuts in the vagina, there are no wounds, no ulcers, that the cervix looks healthy. And usually we'll normally do a pap smear if somebody is not at that point bleeding. If they've come when they are not bleeding, we'll usually do a pap smear. And then we'll send somebody for that ultrasound, which again will tell us is everything normal inside the pelvis. You might find that there is an ovarian cyst. You might find it is endometriosis. So the ultrasound can give a lot of information about what is happening with the periods. When it is that the periods have delayed, then we can find the inside of the uterus. Is it the area called the endometrium, the one that bleeds? Is it growing well enough? Has it totally shrunk? In some things we call Asherman's disease, where the endometrium really just kind of thins out even if somebody is young. So we'll be able to look at the endometrium. We'll also be able to look at the ovaries with the ultrasound and see are the ovaries shrinking? Because when we do reach around menopause or perimenopause, or if we have premature ovarian failure, insufficiency, then the ovary usually shrinks. So we'll be able to see is the size of the ovary the normal size or not. So there is a lot that can be garnered through an ultrasound, and in fact it's almost for both sides, whether it is a delayed period or whether it is a too much period, or even whether it's a painful period, too much cramping, then the ultrasound has a lot to contribute in diagnosis, because if it's painful, then we'll usually be able to pick pelvic inflammatory disease, we'll be able to pick endometriosis with the ultrasound. So that's the mainstay of actually literally the basic thing that should always be done when period irregularities are being encountered. Beyond that, now comes some more specialized investigations which your doctor might or might not do for you, and one of them is laparoscopy. Laparoscopy is where we inspect the inside of the abdomen. You get into the abdomen through minimal access, and then you're able to inspect. This one, the laparoscopy, is especially good for checking for endometriosis and seeing how far the endometriosis has spread, because this one is seeing visibly with their physical eyes what is happening inside. So your doctor may or may not take you for laparoscopy. They may or may not take you for what is called hysteroscopy. Hysteroscopy means, again, putting a light inside the uterus, this time through the vagina, and inspecting the internal wall of the uterus. And especially when somebody has been diagnosed with endometrial polyp, then that is usually a way of confirming, and also sometimes a way of removing the polyp, surgically removing the polyp. So hysteroscopy might be something that your doctor would recommend for you to do. And then they might recommend what is called diagnostic curettage, which means that we scrape, the layman word is scrape. We scrape some material from inside the endometrial cavity, from inside the uterus where the baby lives, and we send it to the laboratory for them to check out what the material might be carrying. Is it something good? Is it something normal? Is it something abnormal? So a D&C may or may not be done. So that's your doctor, and if they want to do more examinations, allow them, just get an explanation and allow them if they need to be done. Now, once the investigations have been done, then comes the management, which I never manage on this forum, because management is not individual. Much of it is standard, but it can vary a little here and there. But the thing I would want to say is that management depends on the cause. For example, if it's an ectopic pregnancy, that one straight away, one goes for surgery very, very quickly. If it is a polyp, you can choose to leave it alone and wait and see, or you can choose to remove it. So now some of these things, but are depending on the gravity of what the doctor is seeing, that is the problem. So they will usually treat the cause of according to the cause of either the lack of periods or the too much periods. Now, one thing for sure, when somebody is bleeding too much as a routine, then a correction of anemia is necessary, and this would have been given by how much blood level one has when we do the full blood count. So as a routine, anybody who is bleeding too much should ideally be corrected for anemia, either given medicine prophylaxically to make sure they don't get anemic, or if they are anemic, then they are given the necessary drugs, or sometimes up to the point of blood transfusion, actually. And then if it's a question of pain, then some analgesics are given. If it's a question of endometriosis, depending on, again, what if somebody wants fertility, what the whole history, there's a lot to be decided as one decides what kind of management they will have. So I would leave that to your doctor to be able to discuss with you as to what the best way forward is for menstrual irregularities, menstrual abnormalities, whether it's too much, too little, too frequent. And now we come to the prevention of it, prevention of these abnormal things. And the best way to get normal periods is actually to nutritionally stay well, to stay healthy, to stay exercising. Do not over-exercise, because, like we said, those athletes tend to miss periods, so do not over-exercise. On the other hand, do not lose too much weight, do not get obese, and then this is, of course, easier said than done. Do not get stressed. So I don't know how you're going to do that, but somehow find a way of managing the stress, because stress is actually one of the commonest reasons why periods become irregular. Sometimes there is not much you can do about stress, like if you are to lose somebody, a loved one, then your body just kind of shuts down and will miss periods for some time and then eventually wake up. So I'm talking about the stresses that you can do something about. So try to live a stress-free life. That is takeaway. Live a stress-free life. And if your periods change for any reason, I keep telling you people on this platform, please, please, disturb your doctors. Just disturb them. Keep going, and keep getting told that everything is actually quite normal. And if it's not normal, then it is dealt with. And we've all agreed over time that the earlier something is found, even as bad as cancer, the earlier it is found, the more likely that it will be treatable and curable. So that ends my talk on abnormal periods. Now we will have questions. We will have any questions that somebody would want to ask. Then I'll call my tech guy to come and ask these questions. I can see one already here. That hello doc, is it healthy stroke okay to intentionally delay your monthly period? That's what MP is, monthly period. It depends on what you are delaying it for. I think that's the answer I would give. If you are, one of the times I delay people's periods is if they are getting married and the period is going to land on their honeymoon. So yes, that time I would say delay your periods, or there are some people who go to some pilgrimage or something, and for a month they must not bleed. So yes, it is possible to delay your periods if your system is such that you can take hormones. Then it is possible. It would be possible to delay your periods, because the way we delay them is by using hormones. So if you are somebody who is like very, very hypertensive, diabetic, then it would be very difficult to delay your periods. But if you're healthy, you can delay your periods up to about 2 months, and there should be no problem, except that you delayed your periods. And then when they come, you expect them to be a little bit heavier than normal. But yeah, it is okay sometimes for real reason to delay your periods, but not for longer than about 48 hours. Sometimes, 48, not 48, that's 2 days. 2 months. Sometimes when we do surgery on the uterus, we delay the periods so that there is no disturbance on the scar. So yeah, sometimes you need to delay the period, but don't delay for more than 2 months. Okay, I can't see the other
one. It says, hi doc, I am 3 months pregnant. I'm having a heavy white discharge plus abdominal and left pain. Then there's something in my throat sliding up and down, and it's choking me.
Well, 3 months pregnant, white discharge, that if it's heavy white discharge, that sounds a bit like yeast infection, which is very common when you're pregnant. Get yourself checked. If it's only yeast, then no problem. If it's a bacterial infection, then it will need treatment. The pain on somewhere in the abdomen. The pain in the abdomen. Yeah. There's a routine ultrasound we do at week 12 of pregnancy, which is about what 3 months is. You should have that ultrasound done to also check what is that pain in the left. It could be that it is your ovary having what is called a luteal cyst. A luteal cyst is something that is very useful, that supports the pregnancy. But you also want to make sure it's not another abnormality that is on one side. So you want to do your ultrasound of 12 weeks It's usually a routine ultrasound we do to check that the baby has developed all their organs very well, and in the process you'll be able to be told what might be the cause of that pain in the side of the abdomen. Now, this thing that is in your throat that it comes sliding up and down and is choking me. You might be, well, this one you need to be checked, but you might be having what is called acidity. When you become pregnant, then they are called the gates, the sphincters, the gates that separate the stomach from your food pipe is sort of open. It loosens out. So it's possible that some acidity goes up and goes down and it's choking you and you feel like coughing. But you need to just go to your doctor and confirm that is all it is. So you need to go and get yourself an ultrasound. You need to go and get confirmed that discharge is just yeast infection. Yeast infection will be treated and it's not harmful to the baby, but if it's other infections, they could be a bit harmful. And then, one needs to really check your throat and make sure it's just acidity.
All right, so the next question says, hi doc, please explain how thyroid gland is associated with irregular periods.
The thyroid has a very important hormone called thyroxine. When thyroxine is too little, then the people become what is called, I don't want to laugh, I don't want to smile, but the people slow down and they become what is called a cretin. I don't know, those people who don't look very clever, and that could be thyroid. And in that case, that would the other extreme is when they have excess thyroxine, and that's where hyperthyroid, and that's the people occasionally, if it's very severe, you see them with eyes popping out, with heart rate going very fast, with heart palpitations, sometimes even high blood pressure goes up. So the hormone thyroxine is very vital, even in maintaining pregnancy. So we want, if it is abnormal, if it's either elevated or lowered, then it interferes with the whole of reproductive system and the whole of bleeding system. So it can either bring a lot of periods or it can delay periods. And sometimes it causes miscarriages. And you will notice that when you become pregnant, one of the things we check is that your thyroid is working well. So either delay or over bleeding, get one of the hormones that is checked is thyroxine, which is produced by the thyroid.
Oops. This one is asking, when you talk of nutrition, what food or supplements are termed healthy in this context?
Foods that will give you enough blood levels. We are talking about if it is overbleeding. Let's take the overbleeding bit. We are talking that you need to have enough blood so that when you bleed, you still have some reserve. So the nutritious foods would be very, very dark green vegetables, and we are talking big helpings of them. And anything that raises your blood levels, beans, anything that has iron in it is very good. Red meat is also good, but taken in moderation, because red meat has its own issues with a bit of cholesterol, and if somebody is in a group of making fibroids, then red meat tends to grow fibroids a bit faster. But you still need red meat because you want to get vitamin B12, and that's the only natural source of vitamin B12. So yeah, we are talking a bit of meat here, a lot of greens, and eat healthy. Yeah.
All right. So this one is asking, what causes an embryonic pregnancy or blighted ovum? Can it be prevented?
Wow. An embryonic pregnancy means that a pregnancy happened. When a pregnancy lands, a pregnancy is three things. It divides itself into a baby. Well, first of all, it divides itself, it attaches itself and they will make a placenta. Some material will make a placenta, some material will make the fluid that the baby will swim in, and the third sort of material will make the baby. And sometimes the pregnancy will happen, it will make the placenta, it will attach to the mother, and it will have the fluid that the baby swims in, but there will be no baby. And that could be that the baby was, the attachment either was wrong from the beginning, so the baby part didn't quite actualize. And the other thing is that at attachment, a bit of bleeding happened from that detached the mother, so it wasn't possible to make a baby. It is becoming what is called blighted. Blighted means like maize. When maize is blighted, it means there is a maize cob, but it has no maize, and it's the same thing that means blighted. So there are a number of things that your doctor would investigate as to why you are blighted. Sometimes it's the hormones are not enough, and sometimes you need support of hormones. And yes, the other thing is that if you have ever had a blighted ovum, then the minute you know you're pregnant, then you report to your doctor, because it's possible to salvage some pregnancies before they blight, because it is possible to find the heartbeat as early as 6 weeks. If now at that time there is a heartbeat, then we start hormonally investigating and trying to support the pregnancy and hoping that it will not blight. So but blighting once doesn't mean it will blight again, so do not give up hope, do not be very distressed. It can blight and not ever blight again, but sometimes it's to do with hormones. But what it means is that the baby didn't quite get the ability to form for whatever reason. Sometimes it may even be that it was genetically going to be unable to survive. So there are many reasons why sometimes we blight. The material that is blighted, when it is gotten out, if it were to be gotten out from what we call evacuation, then we'd send it to the laboratory. These days we don't always have to send it, to do it by evacuation. You can do it by medication and let the blight come out. Sometimes a reason is found, sometimes no reason is found. So yeah, it's a tough thing.
All right. How rare is a pseudosac occurrence, where there is a sac in the uterus and another in the ovary? How can the doctor tell it's an ectopic for sure?
Well, the pseudosac, there can be a sac in the uterus and a pseudosac, and that's the same thing as the blighted. It's a sac that has no baby. There can also be a sac in the tube. If it is the ovary, usually it is not a sac, usually it is what is called a luteal cyst, and that cyst is supposed to be supporting the pregnancy. A luteal cyst is in the ovary, is made by the ovary, the mother ovary, to be able to help the ovary to make more hormones to support the pregnancy. And usually when there is a luteal cyst, if the heartbeat has been found, then usually the pregnancy will survive. So I don't know what one can tell it's an ectopic when it's got some interesting material inside it. But if it's inside the ovary, that's usually a luteal cyst, not an ectopic. Although there can be what is called abdominal ectopics, But those ones will actually have formed a baby, a fetus, and you'll see that it's a real one because there is space for it to be formed in the abdomen outside the uterus. And again, that is also a dangerous thing. It's something that needs to be dealt with.
Okay, so this is some of the ones from
These are over.
Yeah.
Okay.
So far.
All right.
Is it normal to receive periods while using Depo?
Yeah, it is. It is. What Depo does is it destabilizes the hormones. It's one hormone only, and a woman produces two. So the usual routine with Depo is that the first time one gets the first Depo, then they spot for 3 months. They get another Depo, they may spot. But after usually 2 Depos, the periods will disappear, and somebody will stay without periods. But a lot of the time, a few, not a lot of the time. A lot of the time, periods will disappear with Depo. A few times, the periods will come like every 3-4 months and come very heavy. And even in fewer people, the periods will come normally, I mean monthly. But that is pretty rare because Depo is a fairly powerful hormone. It tends to take away periods.
All right. This question says, my friend is pregnant and has muscle pulls on and off on both legs. Is this normal?
That almost means she is short of calcium. If it is both legs, if it was one leg, we would worry about DVT, about a clot, a thrombus a clot in the leg, deep vein thrombosis. But if it's both legs, most likely that means it's lack of calcium, especially if she's getting them when stretching.
All right. Is it normal to have a watery discharge and blood after delivery?
Watery discharge and blood.
Yes.
Every woman bleeds after they deliver. It's called lochial loss. And you are allowed to bleed up to 6 weeks. Seeing real blood, it goes from bright red to brown to pink, and it can stay up to 6 weeks. Thereafter, you may stop before 6 weeks. Most people will stop bleeding after delivery in about 2 weeks. Then they get what is called what looks like a yellowish discharge, the way a wound would, I think that's what she's calling a clear discharge, the way a wound would ooze water, but it's not clear water. It's watery and yellowish, which is still normal, and then finally it eases off. So after 6 weeks, there should be nothing like that happening.
Can it happen though?
So
The discharge, that like watery discharge even after the 6 weeks?
Then that is abnormal. That would mean that there is maybe an infection, and they need to be checked for what is called postpartum infection, puerperal infection. They need for a checkup.
I hope I pronounce these words properly. Reason for first and second baby with thanatophoric dysplasia and polyhydramnios at the same time. What can I do for a healthy baby? So I think this person had the
Twice.
first and second baby had thanatophoric, I'm saying it right, yeah? Thanatophoric dysplasia and polyhydramnios.
Polyhydramnios is not the baby. Polyhydramnios means the swimming pool was very large. That one I would just say, just see a genetics person. They need genetic checkup. They need a lot of genetic screening indeed. I'm not sure how much we can do in this country. I'm not very sure about that. But yeah, that's the answer. We need genetic screening to be able to be told the chances. It's a very rare condition. I said here one other time, it's a very rare condition, but it seems like it struck twice. The way lightning is said to strike twice, it's a very rare condition. That I'll leave it to the genetic people to assess.
Okay. So this next question is, it's been 5 months since my last period. I am not pregnant. I was advised to use pills when I went to hospital, but I'm not comfortable with using pills. Is there anything I can do to get my periods back?
Well, first of all, they need to check why the periods are not coming. Uh, she's how old? The issue is she, what is the problem? Is she very stressed? Is she obese? Is she an athlete? Whatever. It needs let them just, first of all, go to that video and see if they fall into the category of all those reasons what I gave why the periods would delay, and then ultimately maybe you would need to have your ovarian reserve checked as to why you are missing periods. It could be a hormonal issue, it could be an ovarian failure. You need to have your doctor really check. Periods, taking pills to get periods is not usually the answer, because when you take pills, then the pills take over your system, and the periods you get have nothing to do with your body. It's because you took hormones, you raised your hormonal level, and then you stop taking the pill, you dropped your hormonal level, and you bleed. So the bleeding of pills has nothing to do with your ovary, what your ovary is doing. So yes, you can get bleeding with the pill, but that's not your body that is ordering it. So it is wise to first check what it is that is actually causing you to miss the periods before you even take the pill.
Okay. Okay, this one is a question here. Is it okay to use painkillers during menstrual periods? Thanks.
Yes, it is. If they are very painful, but the best medicine for period pains is jogging.
What are the early signs of cervical cancer?
Oh, that's the trouble. No signs. The biggest sign is no sign. That's the biggest problem. By the time that you are having bleeding when you have intercourse, it is actually cancer, and cancer that is made a wound. So, believe you me, the earliest sign is no sign. So that's why we emphasize on pap smear, pap smear, pap smear. By the time you start bleeding, it is actual cancer, which you need to do something about. So yes, don't ignore your pap smears, please. The earliest sign is no sign.
This one, she says, thanks, I'll be jogging.
Good. That's good. Jog. It's the best medicine for period pains.
So anyway, there's a lady here. I think you had addressed this question, but she repeated it as a 17-year-old girl who has not yet started her period.
Yeah, 17 is a bit on the late side. For sure, 18 is a bit on the late side. So please get yourself taken to a doctor. I suppose a 17-year-old has to be taken to a doctor. Get yourself taken to a doctor, and they check your reproductive system. The periods are governed right from the head in something called the pituitary, down through the thyroid, through your ovaries, through your uterus, and sometimes it's even that a period is coming but the outlet is blocked. So get checked from literally head to toe as to why you are not getting periods from at age 17. But yeah, age 17 is a bit on the later side to not get periods, especially this generation. This generation is getting periods at age 9.
Okay. Again, this one has some words here that are a bit tough to pronounce, but I'll try. Is this a product available locally? It's an oral contraceptive pill, spironolactone, an anti-androgen that decreases the production of testosterone for hormonal imbalance.
It is available. It's sometimes given to people with polycystic ovarian syndrome. But yeah, it would be available. But you need to really you need to have your doctor really assess that you need to take it.
Okay. Is spotting days after menses related to endometriosis?
Spotting, what is this? I wonder what that means.
I don't know how she wasn't specific. She just said days.
If she means that she finishes a period and a day or two later she's still spotting, that is normal. Because the whole of the endometrium may not shed at once. Some people will spot will finish the big flow and spot for a day or two. Some people will spot at mid-cycle when they are ovulating. That's like 2 weeks before the next period. Some people will have the mid-cycle spotting. So I do not know what she means spotting for days after periods. But if it is something that is new to your system, then it's wrong. It should be checked.
That's all the questions.
Okay. All right. So we are good to go. One of the things that has been asked a lot is about Kegels. So next week, hopefully we shall tackle Kegels exercises. Like I said, this video is somewhere, I don't know, ask the tech guys. It is somewhere. You can see it and then add up what we have said today, so that you have a complete thing about menstrual abnormalities. So thanks for joining us. We said other requests as to what you want us to talk about. Otherwise, we shall just say bye and stop talking. Yeah.
Okay. Thank you so much. Good night.
Good night.